Welcome, everyone, to our very first Lunch and Learn of 2026. I'm Amanda Lakin. I'm the Director of Communications for the Nevada Housing Coalition, and I have just a few announcements before we get started today. Just a couple upcoming events I want to note for our coalition members. We have two town halls coming up, one in Northern Nevada on February 24th, one in Southern Nevada on March 3rd. So if you would like to get together with your fellow coalition members, Maurice and myself and some of our board members, we're just going to have a couple hours where we talk about some of the issues that you're seeing regionally and kind of help prepare for our policy forums that are coming up this summer. So great networking experience and a way for you to just kind of share what you're seeing in your own organizations. And talking about the policy forums, we don't have official dates yet, but they will be coming up in July. And this will be yet another opportunity for our coalition members come together, networking, and we're really going to focus in on policy and advocacy opportunities for next year's legislative session. And last but not least, we have our 2026 Nevada Housing Conference coming up in September this year. We're doing it a couple weeks early. We're going to be in Reno at the Atlantis Casino on September 23rd and 24th. So put that date on your calendar. And two other notes that I forgot to mention. At the end of February for our next Luncheon We'll Learn, we are going to host the Nevada Housing Division. They're going to give an update on AB 540. And we don't have a date yet, but we're going to have Emily Kadick from the Affordable Housing Tax Credit Coalition and Joshua Urich from Midwest Housing Equity Group. They're going to be presenting a webinar probably in March, and they're going to be doing kind of an overall housing landscape of Nevada and across the country. So those are my updates. I'm going to hand it over to Maurice, who's going to kick off this awesome session.
Awesome. Thank you so much, Amanda. Good afternoon, everyone, and welcome to our first Housing Coalition Lunch and Learn for 2026. First and foremost, I want to start by just saying thank you. Thank you to all of our coalition members, our partners, and everyone just who continues to show up, stay engaged, and lean into this work with us. Your time and attention to the matters at hand, we truly don't take that for granted, and we love the fact that you're supporting us and continuing to put in the hard work. As we kick off the new year, I'm excited to share that we have a full calendar ahead. You've already heard multiple events that Amanda has shared. But again, we will have more lunch and learns, policy briefings, trainings, regional convenings, opportunities for deeper collaboration across the state. This year is really about moving from conversation to coordination, making sure that relationships we built are translating into real systems change, and real outcomes for our communities across the state. And that's exactly why today's conversation is so important. Our theme today is built around community in action, county housing efforts, and what's ahead. We're bringing together leaders from Churchill, Washoe, Clark County, who are working every day at the intersection of social services, homelessness response, and community housing. These are the folks that are dealing with real people, with real constraints, with real urgencies, and at the same time thinking strategically about what's needed next. So today you'll hear about, as I try to set the stage, about their programs and populations they serve, success stories that are showing real progress, priorities, gaps that they are focused in on in 2026, partnerships that can make the biggest difference, and how this all connects to policy conversations that we're heading for the 2027 legislative session. So again, this is not just an update. It's a look at how local systems, state policy, community partners all need to line up if we're going to be and remain serious about keeping housing at the forefront in Nevada. So I just want to say this clearly. The goal is not just to listen today, but to think about how we all can plug in as developers, service providers, funders, advocates, local governments, and residents. We want to strengthen what's already working and help close the gap that still exists throughout the state. And so we are incredibly grateful to our panelists for making the time to join us and for the leadership they bring to our communities. So today you will be hearing from Shannon Erst from the Churchill County Social Services and Central Nevada Health District, Sabrina Sweet from Washoe County, Brenda Barnes and Serena Moore from Clark County Social Services and Continuum of Care, and Dagny Stapleton from the Clark County Community Housing Office. Each of them brings a different lens, but the same commitment to making housing systems work better for the people who rely on them. And so, with that, I'm gonna shut up and I'm gonna turn this over to Shannon with our first presentation. Shannon, all yours.
Thank you, Maurice, and thank you, Amanda, for actually having us. We're very grateful for this opportunity. I just first want to start off by saying that, housing is an issue across all of state of Nevada, but it's very different when you look from the rurals to the urbans. So it was very nice to be highlighted with a rural project. Next slide. So when you look at Churchill County, we're 60 miles east of Reno and about 389 miles northwest of Las Vegas. So when you think about the challenges of bringing resources, this is something we have to really add to the lens. We serve a 5,000 square foot mile radius here in Churchill. We only have one incorporated city, which is City of Fallon. We have a population of 26,000. We're looking at just that 0.45% growth annually. We have a median income, though, the 73,000. So when you look in a rural area, that can bring challenges with the housing market and bringing additional developers to our area. We have a Medicaid enrollment of 7,500 people. So really looking at that, we have a high Medicaid area, but then we have individuals that are normally working out of our community, but live here, but have that higher median income. Our average rent for 2-bedroom is $1,300 per month, and for 3-bedroom, it's grossing at $2,000. This has been a huge change that we've come across since 2019. Next slide. So our housing story really started in 2002. The Rural Nevada Continuum of Care really launched. We were a member of that. And so in 2003, we were the first rural housing project that was funded through HUD and the Continuum of Care, bringing the first transitional housing project. We started with 5 scattered sites in case management. As we all know, case management is really key to success for our unhoused. In 2004, we found that we really couldn't just take individuals directly from the street and into housing. You have to build that trust with the landlords. We have a very conservative population. They didn't understand how we were trying to serve and bring this case management, how it really worked. It was such a new concept, especially in rural areas. So we were awarded the ESG funds. This allowed us to have lodging and put some rapid housing in place. Our goal was to show these individuals were successful in case management. We're getting them linked into those services, and now they're stable enough that they should go into housing. We call this our provisional assistance through housing. In 2016, we found that we had a lot of individuals that were stable, but they had a loss of income for a short period of time. But we didn't want them to lose their housing. So how could we really work with them when they Section 8 vouchers were taking so long? You're looking at up to 2-year wait list. And so these individuals were now losing their house and now becoming unhoused. And so we did obtain our low-income trust funds for short-term rental assistance. This is where somebody's in their home, they had that short period of time that they had a loss of income. Now we could provide a subsidy. We could pay for those arrears. We could really look at how do we stabilize them in their housing so they didn't lose it and provide them short-term case management. In 2017, as you know, with HUD, everything really transferred from going from transitional housing to rapid rehousing. Well, this did work for our plan because our goal was really to reduce barriers to get into housing. Now we had a good relationship with landlords. But then in 2019, as we know, we all come across these challenges that hit us every day. Our rents started increasing dramatically. We are home of the Naval Air Station, Top Gun. They started doing remodels on all of their housing out on the base. What that did to us is as they took down 65 units, they only replaced it with 60. It moved a lot of our military families into the community. This also caused for our housing market to start to increase. Before you could get a 2-bedroom for $600 a month. Now we started going up. Now we also had the fact of the affordable housing was being taken from those that were losing in other housing and pushed over into that area. So we had to really determine something strategic so that we could get individuals housed quicker and not have them on the streets as they waited for 1 or 2 rentals to come up in a year. So we started developing really how we could change. We looked at the rapid rehousing model with HUD and we reapplied just to maintain those units. But in 2024, it was sadly, we did not rank high enough and we lost all of our HUD supportive housing funds for the rapid rehousing. Next slide. So how do we look at making things over for 2026? We called it our makeover. So our goal was to maintain access to housing for literally homeless and those that have fallen on hard times, increase access to services and supports where unsheltered feel comfortable to go, and respond to increased rental costs and overall lack of housing to support those needs. Our goal was to launch this year, and we are on track at this time. Next slide. We were very excited that we could really look at how we maintain our provisional assistance through housing. It's really using low-income trust funds and county dollars. This program maintained for those that had a loss of income for a short period of time. We will serve those at 60% of median income and have adequate income to support current housing situations. So it's really looking at those that it was that short period. Now they have the funds, they can move forward, and there will work with us with case management. We want to maintain that stability. How do we ensure that they are linked to all resources, such as any supports they need, gaining increased income, increased education, things that maintain that support. And so we've been able to provide the wraparound services, the arrears for rental and utility assistance, up to 6 months of future subsidy. Next slide. We were very excited when we were looking at what we were going to do that the Home Means Nevada initiative was released. It was really quite fortunate. I was in a meeting and they were discussing this. And at the time, it really said local governments could only apply for land purchases. And I did mention to them, this is a challenge. We have the land in local government. We don't have the funds to build or rehab. And they said, go ahead and put in an application and we can look and see if it aligns. So we were awarded $1.7 million. We purchased a complex with 2 duplexes and 2 houses. And that's a picture prior to our starting of remodel. With this, we are able to remodel these units, and we're now calling it the New Pass House and Day Center. It will have a manager's unit. We have a men's 4-bedroom SRO housing, women's 5-bedroom housing with a family unit. And then the big piece with this is really having a day center. The day center will allow for individuals that are unhoused or risk of being unhoused to have a place to go to meet with caseworkers, not just to discuss their current situation, but what the future can look like. So we'll do on-site intake. We'll also provide the case management for all of our housing programs here. We've allocated space for group counseling, medical services, showering, laundering, and a warming kitchen. Our whole goal is to have one spot where you can come and you can access these resources to help you. We are working with several partners. We're looking at the the healthcare component being really with Central Nevada Health District. So we can do immunization, some regular checks, and bring that public health model there. We are contracting with 2 different counseling services so they can come in and not only do one-on-one counseling and intakes, but offer group counseling. We've allocated different space so that they can be warm and comforting for them. So we are opening this in July of 2026. Next slide. So really looking at Churchill, we've had to be open to the Etch-a-Sketch process. And that people that know me, I've used this for years. Really, when things aren't working, you have to shake it up and try something new until you get it right. And I won't say every time we've tried it, everything works perfectly, but we're always willing to add new partners, change what we were really, how that goal was, and so that we can make it work. Next slide. And with that, I really thank you again for having us, and I can't wait to hear everybody else. Jackie Stewart is also on the call today, and she's our Essential Services Supervisor, and she'll be available for questions at the end.
All right, thank you, Shannon. Just FYI, housekeeping, if you have any questions, you can either put them in the chat or we do have a Q&A feature. So if you do have any questions, you can place them in there. We will try to get through the presentations before we ask any of the questions. So again, if you do have them, if you don't want, make sure you don't forget them, go ahead and put them in the chat or the Q&A feature, and we will get to them towards the end of the presentations. Next up, we have Sabrina from Washoe County that will be talking about what's going on in their community. Hi, Sabrina.
Hello, everyone. Thank you, Maurice, and the coalition for having us all here today. I agree. It's great to be here with everybody else in our state and learn a little more about everybody else's services as well. So my name is Sabrina Sweet. I am a coordinator with Washoe County Housing and Homeless Services. We are under the umbrella jurisdictionally here under Human Services Agency, which provides services to basically any person receiving county government services in Washoe County. Locally here, Housing and Homeless Services, we started as a brand new division in 2022. Previously, all of the shelters here in Washoe County were run by the city of Reno, and we transferred those services over to the county in late 21, and then we hired an entire division of county staff in 2022. So we like to joke that we are building the plane as we are flying it, and we're learning a lot over the past 4 years. The population here in Washoe County is a little over 500,000, and it's projected to grow about 15,000 this year. Our division, we focus on not only our shelters here locally, but we also have our regional team that focuses on the COC and Built for Zero efforts, tenancy support, and also securing funding for housing within our region. So I have 9 slides of demographics to show on our shelters. I know it's a lot. I'm going to breeze through them, but I wanted to be able to send the info out after this meeting today. Thank you, Maurice, for flipping. So we have 2 different shelters. Our place is a women and family shelter. We have 38 family rooms at the shelter, and the wait list is approximately 15 to 40 families at any given day. Most of our families are self-referred because they have some sort of temporary living arrangement, and about a third of our cases or families over at the shelter are referred through Child Protective Services. Next slide, please. For the families, our heads of household have lower chronic homeless numbers and also lower substance use numbers than the rest of our clients at the shelters. Next slide, please. So this slide and the next slide is for the single adult women at our place. Again, the women and family shelter. We have 158 beds for single adult women over at the Our Place shelter. And the numbers for the disabled and also for our individuals who self-report their mental health diagnoses are higher than our families and also the clients over at our CARES campus. Next slide, please. And then you can also see here that the substance use numbers and those chronic homeless numbers are higher than the families, and then the substance use again higher than that over at CARES. You can flip to the next one, please. So CARES campus, our emergency shelter, We have 549 beds over at that shelter. For those of you in Washoe County or those of you that have been to that property in the past, it's a 15-acre property. It includes the emergency shelter, our day use resource center, and also our safe camp location. So the big shelter there has 549 beds. 493 are for men, 56 are for women. And at that campus, we do have a much higher population of individuals who are over the age of 50 or are disabled. Next slide, please. And from those individuals at the CARES campus, the big shelter, we do have lower substance use and higher chronic homeless numbers than our single adults over at our place. Next slide, please. So this one and the next one are that safe camp location, again, on the same grounds as our big shelter at Nevada CARES campus. We have 50 individual pods at safe camp, and typically those individuals are higher need, higher acuity. They are coming directly from our COC outreach efforts, so people that are in encampments along our river and throughout our community. And we see a lot higher percentages of disabled, mental health, substance use, and also chronic homelessness. We can go to the next one. This is just showing those substance use and chronic homeless numbers. Next slide. Thank you so much. So I did get through those pretty quickly. Thank you so much, Maurice. So this is just showing average length of stay for our different shelter locations. Average length of stay ranges anywhere from 28 to 122 days. Again, you'll see that safe camp number is a little bit higher based on need and higher acuity for those individuals in particular. And currently at our shelters, our oldest active enrollment is from 2022. Next slide, please. We are super excited up here in Washoe County to have opened up a brand new permanent supportive housing building on the CARES campus property. We got a grant through the Home Means Nevada funds to build the building, and then we also have 5 years of staffing available at that location. We are practicing a full assertive community treatment, so an ACT model at that location. We have 50 units, 65 beds, so some dual occupancy. But the intent is that we are wrapping that ACT model, all those staff that are listed here on the slide, around the clients. We're helping them learn independent living skills, secure income, and hopefully eventually be able to move out into the community into their own housing unit, apartment, whatever that might look like. And then as of Monday, we have moved in 25 residents. Again, it's only been open since October, so we're really excited moving forward with this new project. Next slide, please. As all of you, I'm sure, experience, it takes an entire community to help try to fight this good fight of ending homelessness. We have about 50 community partners here in Washoe County that have signed a basic agreement to be able to come to our shelters. So we have different locations at both of the shelters where people can meet with all of our community partners, do assessments, get connected to services in the community. And then also any of our community partners can also come access space at the shelters to meet with clients, provide assessments. We have about 90% of our local providers enrolled in HMIS, which has been super helpful for not only collecting all of this fun data that you see here today, but also just for ongoing collaboration efforts. Next slide, please. For housing and homeless services here in Washoe County, we have multiple dashboards and data available on our website. Our shelter and housing bed utilization dashboards are refreshed daily by 9 a.m. So it's not a true live count on our websites, but we try as hard as we can to keep the information as up to date as possible. all the other dashboard information that we have available, such as these numbers that you see here in front of you right now, are updated either monthly or following specific studies like the PIT count that everybody's working towards getting started tomorrow. On average, our exits to permanent housing with no recidivism are about 80% from all of our different programs. And the highest percentage of our individuals permanently housed are from those families over at the Our Place shelter and then also from our Safe Camp location. Next slide, please. So this is a representation of all the bed utilization in Washoe County. The emergency shelter and permanent supportive housing units do have higher utilization here than transitional housing, and we have approximately 1,700 beds available here in our community. Again, our population is about 500,000, and those numbers are going up and down, which you will see on the next slide, please. This is our PIT count numbers from 2019 through 2025. So as I said at the very beginning, we just started this new effort here with Washoe County. Everything was previously managed through the city of Reno. And so with that, we were able to hire an entire division of staff and really increase all of our efforts towards showing the data and collecting the data, and also just generally in increasing housing. We have had a slight increase in total homelessness. We did not do an unsheltered count last year, but we are doing that tomorrow morning. So we're looking forward to seeing what our numbers look like for this year. Next slide, please. This is our inflow and outflow here in Washoe County. As everybody experiences, if that inflow number exceeds our outflow, our total count, active homeless count, will not go down. So in order to reduce that ratio, we really are focusing our efforts on increasing our affordable housing stock here in Washoe County. Our population is growing very rapidly here, so just a constant effort to increase that affordable housing stock. Next slide, please. Currently, we're pursuing the annual renewal process. I know everybody's going through the same struggles here in their own jurisdictions with awaiting NOFO judgments and just moving forward with that. I do want to highlight that there were a lot of individuals throughout our state that helped fight this effort. Rosen's office was really engaged and reached out, and then all of our jurisdictional partners here in Washoe County sent out letters to try to help avoid any cuts and then really advocate for that one-year renewal process. Reno Housing Authority really stepped up and planned some meetings to discuss any contingency plans and how they might be able to help mitigate any damages from the loss of funding. Next slide, please. And then this is what we're really focusing on in the next year. So increasing programming generally and regionally. We just started a resource fair at our shelters, which again is available to anybody enrolled in any programs here in our community. And we plan to continue doing that through the rest of the year. The first one was in January, and we had over 100 clients attend, which we thought was a fantastic turnout for our first effort here in Washoe County. We're working on filling that supportive housing building, and then in efforts of increasing transparency here locally and communication with all of our community partners, we're enhancing a lot of the dashboards on our website. So I know there's time for questions at the end. Thank you so much for your time.
Excellent. Thank you so much, Sabrina. Appreciate your presentation. All right, now let's switch over to Brenda and Serena from Clark County Social Services and the Continuum of Care. Ladies, thank you again for joining us.
Thanks for having us.
Yes, thank you. Excuse me.
All right. Well, good morning, everyone. I am Serena Moore, manager for service delivery here at Clark County Social Service. I'm going to touch briefly on some of the programs that we offer to try and prevent eviction and create more stable housing opportunities for our community. So in my area, we oversee financial assistance, the eviction diversion program, fixed income rental assistance, and senior financial assistance. In 2025, we issued a combined total of about $6 million in rent and utility assistance to try and create stable housing for our applicants. Through the eviction diversion program, we serve disabled and senior citizens who are facing eviction through the Las Vegas Justice Court. So it's a collaboration with the Las Vegas Justice Court, Clark County Social Service, and Legal Aid of Southern Nevada. Looking forward, in about March of this year, we're going to expand that program to families with children under the age of 1. So what that will look like is adding approximately 2,000 referrals annually to our already 3,000, just shy of 3,000 referrals that we received in year 2025. We have successfully distributed $2.9 million for the eviction diversion program, which has secured housing for about 600 families. Through our financial assistance program, you may be familiar with it, but it is a $400, often called voucher, but it's a check to the applicant. In 2026, we're working to reimagine that program and redefine how it serves the community. We understand that $400 is not going to secure housing. So looking forward, we're trying to expand the eligibility criteria and make it a more reasonable dollar amount. So that's what we will be doing. We also have our Step Up program and our extended foster care program that's being built out. Extended foster care is going to be for the those that age out of foster care at 18, and it will be housing support for those who are between 18 and 21 if they choose to continue in the program living with a foster family or paying rent at a stable home. I think that covers me, Brenda. I'll roll it over to you.
Okay, thanks, Serena. As you can see, we do a lot with Clark County Social Services, an extensive list on the right of what we have available from extended foster care and the youth exiting the family services department, as well as up to our adult care services, and 1,000 things in between, right? And so really excited about that. We can scroll through to the next page. Thanks, Amanda. One of the things we really wanted to highlight, and Amanda, I apologize, can we shrink it just a little bit? We thought it'd be easier for everyone if you got PDF versions of like a flyer of everything we have. So forgive us for, not having great displays for our presentation. But as you can see here, we have the Clark County stair-step model, and it really is designed to show you that anyone can enter into the system of homelessness or housing instability at any level of any area of need. It doesn't mean you have to start at the bottom of unsheltered homelessness or experiencing that before you're receiving any assistance. But our assistance begins, with outreach, or I actually should back up and say, as Serena mentioned, prevention. So Clark County Social Services is not only focused on preventing you from becoming homelessness, but serving you after and making sure that we can get you back into a stable environment. And so Clark County, if you scroll just a little bit more, we have 6 Clark County outreach teams. There are community advocacy resources engagement teams. We have those that focus on intake and assessing, as well as bridging. We call it the bridge to home teams, bridging folks into stable environments where they're still receiving case management, but not practicing independence solely on their own, as well as our outreach teams. We also, as a collaborative applicant for the Continuum of Care, help support the coordinated entry system, which is within the COC, as mentioned earlier when Maurice was introducing us. So we support all of the nonprofit organizations that do the same work. I think most of you all here on this call that are from Southern Nevada are part of the COC, and just really making sure that our most vulnerable are receiving services on the upfront and able to access programs rather than the loudest knock at the door. Clark County funds congregate and non-congregate shelter programs here in Southern Nevada. That includes the Salvation Army, Rescue Mission, Catholic Charities, the navigation centers, the youth non-congregate shelters, as well as 8 other non-congregate shelters here in the Valley. Some of the specific types are listed here in the middle column. Again, you guys are gonna be able to read this on your own, so I'm not gonna go through everything completely, and a little bit more of some prevention diversion that Serena touched on earlier. If we could scroll to the next page. It's a picture of our amazing navigation center. I say amazing because I might be slightly biased, but it is located down off of Fremont Street near Boulder Highway. And we do have a call center. Those of you within the Continuum of Care and here in Southern Nevada, I believe all have access to those contact numbers. And if not, feel free to reach out to me. Hopefully everyone knows how to contact me thus far, but if not, Maurice and Amanda would be happy to connect us. So just a little bit more stats and kind of what we've been doing with those non-congregate shelters. So feel free to read through those and kind of who we serve and some of our partnerships within those areas. So we'll keep scrolling down a little bit. We did want to highlight some of the resources that we have here at Clark County. I think Serena skipped over burials and cremation. That's also under her realm and something that she's made vast improvements on locally here. And then some other partners with our landlord partnerships. Maurice is very familiar with the work that we do there to help engage and maintain relationships with landlords so that we all have someone to lease our families up with that are willing to give them that second chance and just continue the improved affordable housing portfolio that we have here in Southern Nevada. HelpHopeHome.org is the Southern Nevada Homelessness Continuum of Care's website. So there's always information, trainings, funding opportunities that are pushed out through their listserv as well as posted online. The COC membership and board meetings are also available. We also have coordinated entry sites listed so that if you don't know where to send someone, you can pull that up there. And we also have an amazing live resource dashboard to where anyone can pull it up on their phone. And if the individual they're serving is identifying one specific need, you can sort via that need and look to see who's closest to them. If they're walking or if you're able to transport them and get them there as quickly as possible to access that resource that they're seeking. And then scrolling down a little bit more, the cooling stations. This is always a big one here in Southern Nevada. We deal with heat while the East Coast is dealing with the snow right now. And so I feel like this is just as big a serious issue as the winter months that other folks have to navigate. And as you can scroll down a little bit, you see we've got 42 total sites. And right after this section, please, we're always recruiting for more sites, right? But did want to highlight, we're seeking sites that will accept pets, right? A lot of those experiencing unsheltered homelessness do not want to leave their loved one behind, and that loved one is the animal that probably provides them with the most support and companionship. And so constantly always looking for more partnerships and ways we can serve. We do want to shout out to the MCOs serving Southern Nevada. They have been a huge partner this last summer in regards to donations and supplies and resources to those that are seeking respite from the heat at our various locations. And so just really amazed and happy for the partnerships that we continue to maintain and have, available to us. And so again, Southern Nevada and the COC, it's all this big collaboration of work that we do. And then with that, I think the next page, Amanda, kind of just wanted to, I think this is our last page. We wanted to be really fast. There was a long list on the agenda. So sorry if I spoke quickly, but you will receive this. You can read through it. With that, thank you for listening. I'm going to turn it over to Serena to close Clark County Social Services up.
Just real quick, the burial and cremation program does help the indigent population with end-of-life services, the financial component to it. That is a referral process through one of our contracted vendors, and you can find those vendors on the Clark County Social Service webpage. In order to apply for any of the programs that Brenda and I discussed today, you can come into any one of our 5 offices and apply at a kiosk. You can create an online portal application and apply from the comfort of your own home. And going into March of 2026, we'll be deploying a team with laptops to help you apply if you don't have access to technology in your own space. Thank you, everyone.
All right, excellent, wonderful presentation. And last but not least, Dagny Stapleton, who oversees the Clark County Community Housing Department. Dagny?
Thank you, Maurice. Thanks, Housing Coalition, for having us here. It's great to be here with all of our fellow county colleagues from near and far. So great to see everyone. I'm from the Community Housing Office at Clark County. This office was created in 2022, along with our Welcome Home programs, which I'll walk us through briefly today. Our office oversees all of the affordable and attainable housing programs, along with our HUD entitlement programs, home, CDBG, and ESG. Next slide. Thank you. And what we really focus on is, you saw Brenda shared the county stair step, how we talk about some of the housing services that we provide, and the community housing is really the top few steps of that stair step. So permanent affordable housing, some permanent supportive housing, and home ownership. So in 2022, the Clark County Commission did a survey with the community to use our ARPA funds, our COVID funds, and determined that it was really a priority, and the commission voted to dedicate a significant amount of funding to affordable housing in our community, which is identified as a huge need by folks in the community and by the survey that was done. The commission started with $160 million, and as of today, we've invested $270 million. And the need generally that we talk about in Southern Nevada is about 90,000 units for folks at 50% of AMI and below. So the need is really great at the lower AMI levels. We decided to take a multi-pronged approach. We created the Community Housing Fund program, which is gap funding for affordable rental housing. We have development incentives, which actually were begun prior to COVID. We were one of the first jurisdictions in the state to do that. We provide a density bonus and parking reduction for projects that are being developed as affordable housing. We also abate and reduce development fees across county departments to make sure that there's as many subsidies and incentives as we can to get affordable housing built. We provide county and federal land for affordable housing. Right now, we actually have 7 projects in various stages on either a county parcel or a parcel that the county has requested and received from the BLM. We have a program to assess all of our county-owned parcels. The county is a large organization. We have a lot of parcels that we've bought over the years for different infrastructure projects, and so we did a survey of those and determined which of those could be used for affordable housing, and so have granted or sold for $1 some of those out into the community as a subsidy. And then as well applying through the BLM through their affordable housing program to get those federal parcels at very low cost, and then renting those out to developers. And then finally, we are creating a community land trust to provide homeownership opportunities. Next slide. So our community housing fund that we created is basically gap financing for affordable housing. We've put out about $250 million to this point. We have a rigorous scoring criteria application process and have a committee with community stakeholders that reviews and vets those applicants. Our impact, we have about 5,700 units that we have supported either for rehab or new affordable rental housing. And we were able, along with the significant funds that the state invested into affordable housing projects, to save a lot of developments that were in the pipeline but were stalled due to cost increase and other issues because of COVID. And something that we're also proud of is we've had a hand in creating 4 permanent supportive housing projects across the valley, and that we've been able to incentivize a significant increase in the number of 30% units through the incentive that the CHF fund has provided. And this is a picture of Sunrise Ranch, one of the permanent supportive housing projects that the county has supported and that social service is also supporting, with some units for youth aging out of foster care. Next slide. And so our community land trust, we've got our QR code here. We're promoting this program a lot right now, so feel free to please take a look. There's a video that explains what a community land trust is, and we're encouraging everybody to promote this through your networks in Southern Nevada. A community land trust is a model that's been used across the United States for decades, where the community has part of the equity or investment in the homes through owning the land, and the homeowner owns the home. And then there's a ground lease for the homeowner on the land that allows them to use the land and stay in the home. They have a mortgage on the home, so they own it just like a conventional home. But the fact that they do not own that land provides part of the subsidy, along with other subsidies that bring those prices low to make those homes affordable and attainable for the community. Those homes are then restricted upon resale, so they remain affordable for generations to come. We have 240 homes in the pipeline for our community land trust program, which is exciting. One of those subdivisions is on a county parcel, another on a BLM parcel that we received from the federal government. We partnered with a handful of lenders to ensure that those homeowners have favorable mortgage terms on the mortgages that they receive. And we connect them to those lenders through our program. We provide support for home buyers. We provide them counseling as they're entering into our program, and then long-term support through communication and continued counseling is needed to make sure they can stay in those homes. So the long-term benefits of the CLT, that's called the Welcome Home CLT, our housing programs are branded Welcome Home here at the county, is that these homes will be resold also at an attainable price. So basically, we've created a stock of homes that'll be affordable for generations to come because of the structure of the program. The homeowners are allowed, of course, to build equity, even though there is some restrictions on the resale price. They don't get resold at market price, but they are able to build equity through their mortgage, as well as some appreciation in the home price. So we rolled out the program in November, just a few months ago. And so far, we've already got hundreds of people who've come and done our orientation, and our applications for the homes will open later this year. Next slide. So I just wanted to highlight some of the partnerships that have allowed us to make an impact and stand up our programs. The CHF funds, of course, go into those multifamily low-income housing tax credit developments that we partner with private developers on. Also, a lot of those projects we partner with nonprofits on, and of course, the Housing Authority. The permanent supportive housing projects we have supported, there have been partnerships with developers as well as some local nonprofits. So all of those partnerships are important to get more housing units built. The Community Land Trust, the housing counseling agencies across the valley, and then one of them nationally, have been important partners to help us get home buyers educated and supported as they begin the process of buying a CLT home. We're partnering with a private home builder who we think is going to build a really nice, high quality product that'll be as nice as at least as any of the starter homes that are a market price in the valley. So we're excited about that partnership. And then we've had a great partnership with some local and national lenders. Guild Mortgage is a great partner for us. And we've actually been partnering with Fannie Mae to make sure that the loans that are the lenders that invest in our programs by providing mortgages to the home buyers are able to resell those loans to Fannie Mae. And we were one of the first programs in the country, actually, that has partnered with Fannie Mae in this way. So we've been part of a national change that's occurred to ensure that Fannie Mae is going to lend to partners like programs like ours in the future, community land trusts, homes that have these restrictions on them. Next slide. So who do we serve on our portion of the Clark County Stair Step and our partnerships with social service and others? Mostly for our multifamily projects, we're serving 60% of the AMI and below. That's really those low-income housing tax credit properties that are built that we're providing gap financing and subsidies into. We're proud of our in our CHF program that we've incentivized those projects and provided additional funding so that the developers can provide additional units at 30% AMI, because that's really where we see a great need in our community. So a lot of times those conventional affordable housing, low-income housing tax credit properties don't have 30% units in them, or a lot of them, and we've got some of ours have 10% or even more of the units are 30% AMI. So we're excited about that. Our permanent supportive housing that we've been able to support, that's housing for folks with who are most in need, wraparound services for targeted populations for folks coming out of homelessness, and a lot of those folks at 30% AMI. And then this year, our community housing fund focused its money to what we call buy down, so to further reduce the income targeting in the projects that we're funding. So predominantly units at 60% AMI are funded, but we have provided additional or will provide additional funding in our awards that are about to be announced to ensure that there are actually a lot more 50% AMI units available to folks in the Las Vegas Valley, because that's really where we see the need. So we're also proud of those efforts. And the Community Land Trust, we are serving households between 50% AMI and 100% AMI. Also excited that we're going to be able to offer some homes to folks at 50% AMI. Next slide. This is me, and that's our QR code for our community land trust. So please click on that, and happy to answer any questions.
All right. Well, thank you so much, Dagny, and to all of our panelists today. I know we went through a lot of information. We only have a few minutes left, but I think this is a great example of when I talked about earlier in my introduction. I talked about being able to create real systems change and seeing real outcomes. You have the rural, you have Southern and Northern Nevada here that is representing and showing us or showing you, the public, the work that they're doing, and the fact that if we have the resources, we're able to get those resources out the door. We're able to build. We're able to take care of folks. And so, I just want to say thank you for all of the hard work that each of your departments are doing. You are truly valued. Again, the slides will be sent out to all of the participants. This recording, this Lunch and Learn is being recorded. You can go back and rewatch it on YouTube by tomorrow. But one question I would have, and with all the success that you have been able to achieve over these last few years with the funding streams that have been able to come in, what are some gaps that still needs to be filled? And I'll just throw that out to everybody as a panel. If you could, what is your North Star? What is that one gap that if you had a magic wand, you would say you would tap this and things would be turned around? And we already know the obvious answer is money, right? But is there anything else outside of that?
I'll jump in because everyone knows I always have a lot to say. So affordable housing, right? I think everyone even listening is screaming that right now. But I'm going to go a little bit differently too, and just say a lot of times our programs end and that's it, right? Clients are left to their own devices, or hey, good luck, you've been doing great, I've got all the confidence in you. But it's that aftercare. And we hear that some folks are doing it, some folks aren't, but it's that, hey, did anybody think to check in with them before, they end up coming back and returning into homelessness? And so I think we can all, my programs included, could do better in checking in with clients after we've exited them and put them into their own housing, to make sure that they've really created some habits to be sustainable on their own and continue to maintain self-sufficiency.
I think I'll jump in there after Brenda. I think that more effort in diversion and meeting the needs of our community folks that are living paycheck to paycheck and barely getting by in one crisis is going to change their situation so dramatically that housing becomes unobtainable. So I think more efforts in diversion would be a really big deal.
Excellent. Thank you.
I would echo all of that. And then here in Washoe County, we actually had an outside consultant come do an analysis of our community, and we need an additional 1,100 units of permanent supportive housing. So in order to gain that permanent housing in the long run, we do need a lot of permanent supportive housing units here.
And Sabrina, let's add on to that. I mean, I know that you did have that analysis done a couple of years ago. How has that impacted decision making with the county commissioners? or just within your department. When those numbers was provided, and we saw that, I believe the number was around $3 million, or it could have been more, that is needed just to create more housing. How did that fare with the county commissioners and other folks that read the report?
Well, what I can speak to is what we are doing to try to meet those needs. So there were a lot of efforts put forth to gain funding to build additional permanent supportive housing here in Washoe County. Like I said, we just finished that 50 unit, 65 bed building on the CARES campus. There are a couple other projects going up along our 4th Street corridor. Right next to us, adjacent to the property, is a 3-acre property being built by Accessible Space. It's 120 units. I'm blanking the number off the top of my head. I think 70 of those are permanent supportive, 50 are permanent supportive housing, 20 are transitional housing, and then the rest, they are still working through those numbers. And then to echo what Brenda and Serena were talking about, we're really focusing on those tenancy supports and trying to reduce recidivism rates down the road, and what can we do to make sure that we have the services in place to keep people housed.
Excellent. Thank you all for that feedback. We didn't have any questions come in, but we just did have a couple of comments, which was Nicole L stated affordable housing with allowances for pets. And then Griff C2 stated that places do have any availability, are not always advertising, and the process to access is long, 13 pages or more, which can be very stressful for those seeking care. And then went on to add that names and cost of these providers would be helpful. Clients are asked for income statements, but the amount expected of them is not disclosed. Is there some way this can be evened out? And so I'll just throw that out to the panel. We have about a minute left. If anybody would like to address that briefly, or if you would like for me to email this question out, we can get that information and send it back over to our panel, to our audience.
Maurice, I can share. I'm going to give a shout out to the Nevada Homeless Alliance. They do have a project to help with pet deposits, I believe. And so that may be a resource, as those are helping find lease ups, that maybe it's just that gap of funding for that piece. So shout out to the Nevada Homeless Alliance.
All right. Okay, well, with that being said, we're at the top of the hour. It's now 1 o'clock. I want to say thank you all for your time and dedication and your commitment to the community. Looking forward to seeing everybody next month at our next Lunch and Learn. With that, I will say enjoy the rest of your day, and we'll see you next time. Take care.